I didn't recommend locking anything down. I recommended to the president that we shut the country down. First of all, I didn't recommend locking anything down.
I didn't recommend locking anything down. I didn't recommend locking anything down.
I didn't recommend locking anything down. I recommended to the...
With another episode of Broken Truth. Today, I have the lovely and talented Nicole Sirotek from American Frontline Nurses. Welcome, Nicole.
Oh, thanks for having me, John.
And you know what? I think I want to run a quick clip of you from our movie, Epidemic of Fraud, because you had a really powerful moment. And this will also remind everybody why you're so important to this medical freedom movement. And as a whistleblower in 2020, you really got a lot of attention to an issue in the hospitals in New York. So you know what? Let me just play this and we'll come right back.
No treatment until you go to the hospital. Then your treatment are two things that are bound to kill you: ventilators and Remdesivir. And Tony Fauci knew the Remdesivir would kill you. It is homicide. And if you look, how does it kill people? Kidney failure, heart failure, and all organ collapse.
They rolled out Remdesivir onto a substantial number of patients for which we all saw it was killing the patients. And now it's the FDA-approved drug that is continuing to kill patients in the United States. As these patients get Remdesivir, they have a less than 25% chance of survival if they get more than 2 doses. Now they're rolling it out on children as well, and into the nursing homes or skilled nursing facilities as early intervention. And if you ask me, this isn't a hospital, this is a concentration camp. Absolutely.
Nicole, that was so important what you said. You know, I think you were the last one to speak at the Ron Johnson event. And I think he even kind of rushed you. Like, we got to hurry up. And
he was like, gotta wrap it up.
And then you come in here and just nuke all the doctors and everybody else that spoke with this powerful testimony. What was going through your head when you did that?
Well, I'm going to tell everybody it was completely happenstance that I even got there, because we were supposed to fly out that morning. They said, show up to the Senate. We were late because, government inefficiency of getting in. And then I kept trying to get into the seat, but, doctors kept jumping in to say their piece and everything like that. And so I was the last one, and none of that was scripted. I had absolutely nothing prepared, nothing written. That was all the hand of God, just saying exactly what we saw at American Frontline Nurses, like actually in the front lines, in those hospitals and things like that. So it was what we would talk about every single day at American Frontline Nurses, and what we teach our nurses about Remdesivir and early intervention and, patient advocacy. So that was all just right off the top of my head.
That's incredible.
It worked.
I thought you had written that down.
All the hand of God.
Seriously, I believe it, because it was such a powerful thing. And so many people have now come forward about the Remdesivir issue. There's former feds, there's a COVID Humanity Memory Betrayal Project, which you can see at betrayalproject.org. And still we don't have any progress. They're still prescribing this drug.
They are. One good thing about being invited to speak with Senator Ron Johnson is that, do you remember that little New York Times ticker thing about how it was calculating the COVID deaths and everything, that every time you search like COVID deaths on the internet? Just 2 weeks after we went to the Senate and that video went viral, there was a substantial drop in the actual deaths, COVID deaths, because people knew, like you saw on the arm, and that was a real patient that we had, that wrote no Remdesivir. Everybody knew not to take Remdesivir. So it's still being given because we're not reaching everybody like we need to, but it is getting out there, and we teach everybody. And it was actually us nurses at American Frontline Nurses that coined the term. How do you remember to say it? You pronounce it, run, death is near. And everyone attributes that to Dr. Artis, but I was actually the one that told him that. We gave him a t-shirt with it.
I'll definitely remind him of that. So speaking of Remdesivir, the reason why you're here today is because you have something to announce. Go ahead.
Yes. So The censorship around research, as we all are seeing now 5 years later, it's astronomical. And these research studies that are conducted always agree with their funding sources. So we cannot find actual research that really does tell us what the outcome is for patients that do get remdesivir. When I was speaking with Senator Ron Johnson at the Senate, that whole 25%, less than 25% survival rate after 2 doses, that was actual descriptive data that we nurses at American Frontline Nurses collected ourselves. And we have been waiting and waiting and waiting for this research to be done. And everyone's just looking around like, oh, there's no research. And I told my team, I'm like, look, between all of us, we have thousands of hours of clinical research. We have thousands of hours of education. I alone already have, multiple master's degrees. I've conducted research back as a graduate student 20 years ago. We have clinical research nurses. Why don't we just conduct the research ourselves? And so that really ultimately is what launched us into the remdesivir adverse effects and mortality study that we are now looking for participants for. And we're going to actually look at the data, look at these medical records, and see what the mortality rate is and what the long-term complications of this drug are. Because if you search it up, even in PubMed, the NIH, even in the uncensored browsers on your internet, you're not going to find research about how remdesivir causes birth defects. But we have mothers coming to us saying that they have problems with their children because they received it for compassionate use when they were pregnant, and nobody believes them that these clusters of ultimately birth defects and adverse reactions in the 3rd trimester are related to this drug. Nobody believes them. And we've seen this multiple times with gaslighting, women and moms specifically when it comes to vaccines. So I'm like, let's just conduct the research ourselves. We can do it. We have the capability. Our only biggest hurdle will be funding it, because we do have to pay for an outside party to validate all of our methodologies and all of our data and everything like that for integrity's sake. So that is one hurdle, but we're definitely not going to stop the research. This is a complete exercise of free will. I'm like, I don't need anyone's permission to conduct research.
Good. Now, so what kind of information, and I'll pull up the website, but what kind of information do you need for this study?
So right now on our website, if you were to go to AmericanFrontlineNurses.org, right at the top, you'll see Remdesivir study. And there is a very extensive trial participant form. And this is how we're going to collect a population sample ultimately. And from there, we actually have the study designed out. We will select our participants based off the criteria in that form. Now, we're not going to specifically state exactly what we're looking for, pinpointed in this form, because it'll create, a selection bias and things like that. But it is an extensive form. We want to know, were you vaccinated? Were you isolated? Did you refuse remdesivir? Did your family refuse remdesivir? How many doses did you get? We know that the standard dose is typically 5, 1 dose daily for 5 days, but in New York, they were doing 7 to 10. We also know that there's a cluster of adverse reactions that can happen when you get this drug. We also know that it was given to people who had kidney issues already as a pre-medical condition. We had people on dialysis with minimal kidney function being given this drug, those with acute kidney injury and, stage 1 renal failure were being given this drug, even though one of the common side effects is renal failure. Lots and lots of details in here. The form takes about 15 minutes to fill out. The most extensive part is just having to type in, the participant's name and things like that and contact information. But most of it's click, click, go. And this is what we're going to use to select our participants. And we will collect their medical records. And then the nurses who have been trained to look into these records for the use of remdesivir will go through those medical records, and we will collect the data out of that. Even at American Frontline Nurses, we teach our nurses what to look for with this drug. Like there's actually like an algorithm, I like to call it a deterioration algorithm. At each dose, we know certain things are going to happen to the patient in the labs, in the ventilator settings, and kidney function and things like that. And so those are the things we'll also be looking for in those medical records.
Well, that's huge. I know so many people are eager to have this information studied and looked at. It's crazy to me that this drug has continued to be put in use when so many folks have come forward saying this was forced on me. I mean, we went through a friend of mine's medical records for his mother, and you identified the issues. How 40 references to her being unvaccinated, and this wasn't like she was an anti-vaxxer. This was September and October of 2021. So, that's a huge thing. And she died. My friend's mother died after she was given remdesivir, organ failure.
And I remember that record. It said refused, and then boom, in the medical record, it was given.
They talked her into it. So, this is a really huge thing, and I'm grateful that you're doing it. Now, one of the things that I also look at is, how this can be used legally. Will you have an option for patients to share their data with attorneys, at least contact information?
Yes, when they actually are part of the study. Remember, this is a pre-screening form, right. But if you were to become an actual participant, it will be in the terms and conditions that you'd say, do you give us consent to pass your information along to legal counsel that may be looking for a class action lawsuit? So that's built in for the actual participants.
So guys, if you would like to at least start the ball rolling on a potential action legally, sign up for this. Submit your information. Submit the information of your loved ones. I mean, it's a painful thing to deal with and to do this, but it has to be done. This is just the way, unfortunately. I wish, you've gone through a loss and now you're trying to get through it and recover, and you'd rather have somebody fill this out for you. But unfortunately, the onus is on the patient and the victim, depending on how you look at it, to fill out this form. So I think this is great. And you're enrolling now, right? Like this is live.
It just went live today, I believe. And we're already getting submissions like into the website. People are completing the forms. And I mean, just looking at the raw data, I'm like, the mortality rate is definitely there. Now I know that there could be selection bias and things like that. Right. But I honestly did not believe when they came out with the results of the original Remdesivir study that it said it shortened the length of stay. Now, John, that I was in New York. You've seen some of the additional videos from New York, but I actually have the clinical trial participant paperwork that people opted into that was signed by patients that were already on ventilators. How did their family sign those forms? How did the patient sign the form if they're already on ventilators?
They weren't
allowed in. And it tells you, it says you can opt out at any time. And I'm like, how can they opt out if they're on a ventilator and you don't allow their family to come see them to say anything? And then I know that, the sample population that they used in that study was like 200 and some odd. I'm like, there was substantially more than that number in the hospitals because the doors would be labeled Remdesivir study, but there were hundreds more that were still receiving the drug. So I think that they cherry picked who survived. And of course, that's how they got it, because there's absolutely statistically no way.
There's a lot went wrong here. And if we don't address it, if we don't focus on this and show what went wrong, we'll do it again and again and again and again. And I think this is unfortunately what a lot of us have learned has been going on for much longer than 2020. So, thank you for doing this, and I can't wait to follow up with you, and please keep us in the loop. Now, I want to transition a little bit. I don't know if you've been paying attention to the socials. It's a cat house in there, but today was some pretty interesting stuff. Deborah Birx, the face of coronavirus, in 2020, she has been exposed to recently for saying that, well, let's just watch, and I'll let you make your own decision. But this is shocking how terrible this was. What she says
about childhood. He made it very clear to every mom out there that his children were immunized about childhood vaccines.
Yeah.
And what we've done wrong in public health is we didn't explain that COVID vaccines were nothing like the childhood vaccines, and that the childhood vaccines, like many of the diseases, you get it once, you don't get it again. And this is getting the children to have that disease without getting the deadly consequences. That is not what the COVID vaccine was designed to do. It wasn't designed to prevent against infection. And if you look at the vaccine hesitancy rates, they've doubled since COVID. So we have to start addressing these things. We can't just ignore them.
And Deborah, let me ask you, Deborah, I mean, given that you were the face of COVID from the Trump presidency at the time, do you share, this doctor who I was with, do you share the concerns about the longer term negative impact of some of the COVID vaccines?
The messenger RNA vaccine should have been rolled out for the people that were at risk for severe disease, because that's what the vaccine was developed for. But when we say that we're following the science and the data, we need to follow the science and the data. And the science and the data said people primarily over 65 or people with significant comorbidities were at risk for severe disease. Those are the individuals that should have been immunized first. And we should have put our science behind our immunization schedule and protected those most at risk. It went into young people in hospitals before it went into our elderly in nursing homes. That is not following the science and the data. So I am all for following the science and the data, but it shouldn't just be a statement. It should be a reality. And when we don't match what we do in public health to the science and the data, that is when we get into trouble. And that's when we start to fracture trust with the American people.
what?
I don't know how you sat through that, because I'm over here just.
Well, I've been freaking out about it all day, and actually, I'm glad we're doing this because I've been thinking, like, okay, I've got to do a story with this because this is so ridiculous. It's so ridiculous. I mean, it wasn't just like a little propaganda. They locked people out of work. They fired firefighters for refusing it. They fired people from their jobs.
Yeah.
I mean, they made it a mandate for the entire federal government.
Mm-hmm.
Children couldn't go to school. Kids couldn't go to college.
Mm-hmm.
And there was also evidence that it was causing myocarditis from the very beginning.
Yep.
What in the hell is going on? There was another one today.
Wow.
That from Paul Offit, which I don't know. I guess all the rats are starting to abandon ship now that Fauci can't save them. He's the only one that got the golden parachute.
Mm-hmm.
Let me see if I can find this Paul Offit clip. Yeah. So this is going to make you even more angry. Here's Paul Offit talking to Z-Dog, who also, by the way, is in Epidemic of Fraud, but nobody's allowed to watch that movie. Anyway, check out Z-Dog and Paul Offit. And I'm mad at Z-Dog because he was he mocked someone whose daughter I think had been killed by vaccines while they were outside the studio once. And after that, I was like, you know what?
He's a paid shill.
Yeah, he's no good guy in my book. Okay.
I was asked with 3 other immunology virology types to participate in a conference call about whether or not natural infection should count as a vaccine. In other words, for those areas that were still mandating vaccine, which was many in early 2022, whether they should be able to say, look, here, I was naturally infected here. This should serve as my vaccine card. And that meeting was held with Rochelle Walensky, Tony Fauci, Vivek Murthy from Surgeon General's office, and Francis Collins, and then me and 3 other immunology virology types. So he started off. He said, let's introduce ourselves. So Tony Fauci says, I'm Dr. Tony Fauci from NIID, and then Rochelle Walensky says, I'm Rochelle Walensky from CDC. I said, we know who you are, and the question is, who the hell are we, right? Yeah, Tony didn't need to introduce himself. In any case,
I can't stand this guy.
we voted on it, and it was sort of 2-2, basically. I mean, I was one of I think natural infection should count for obvious reasons. I mean, actually, you're making an immune response off 4 viral proteins. You, in many ways, make a broader cytotoxic T cell response. I think you're better off in many ways. The problem with natural infection is it's misnamed. It should be called survivor-induced immunity because not everybody lives with a natural infection. So,
Yeah.
that was I wish we had then immediately gone to the press and said, look, here's the conversation we just had. Here's the conversation that we went back and forth on this. Because while we all basically agreed, I think that it should count, that the question was bureaucratically, would it work at a time when people could just go on the internet and say, look, I've been naturally infected and get out of it. It's just, it became more of a bureaucratic issue. So I saw Dr. Fauci at a meeting maybe a year ago or so, because I was already getting out there saying, I think we should target high-risk groups, where I was getting a lot of pushback from public health people who felt that I had gotten off the bus. Because, see, that was the whole feeling in this. You're either on the bus or off the bus, and there was no in between. So I'd gotten
Yeah.
I said, Tony, am I wrong? Am I wrong in making? He said, no, you're right. We should target high-risk groups. He said, the problem is, the minute you say that, it becomes a nuanced message. And a nuanced message is a garbled message. If you really want to make sure those groups get vaccinated, then you recommend it for everybody. And okay, so if we think that, we should say it. Because my personal thinking on this is, then if that's the reason we're vaccinating healthy 16-year-old boys, that's not a good reason. And just have it open. Say it openly. You know what I'm saying? Because I think people are smart enough to hear it.
Unbelievable. This guy, nobody forced him to vote to approve the vaccine for little kids in June of 2022. He did that on his own. Anthony Fauci didn't make them, the entire Center for Biological and Evaluation at the FDA, vote for that. All of them in coordination. And they all signal to each other before they actually vote to how they're going to vote. I mean, this is just a unbelievable statement, and they're laughing about it like, live and learn, unless you're, of course, Ernesto or Trista or Maddie or any of the other people that we haven't even had a chance to interview yet, because there's just so many of them.
It's just mind-boggling, because the whole COVID vaccine became it polarized the country. And John, you were there from like the beginning, because you got blacklisted, you got attacked. Like, if you didn't get this, you weren't allowed to go into restaurants. Right. You weren't allowed to go into certain buildings. Yeah. You were denied services. I know that in my community, I got 86 out of one of the county commissioner's restaurants that he owns. Like, he owns several, because I was there trying to get them stop the COVID vaccine into our county buildings and into our schools. It was really bad. And that doesn't even touch on the topic of Team Halo and Shots Heard Around the World and Unnurse Yourself, all these groups that actually went after patients. They went after their neighbors. They went after other healthcare professionals. I mean, they were calling CPS on people because they weren't vaccinating their kid with the COVID vaccine, or they were calling the police because you had gatherings and none of you were vaccinated. It's appalling that this is what's happened. And now everyone's just like, oh, well.
Yeah, no, that's fine. You know what? Hey,
fine.
Everybody makes mistakes. Sorry, we forced your whole family to get the shot, and many of you were injured. I mean, I've had so many people come to me with injuries. I'm not even a medical professional. I'm just some douchebag with a microphone. You're actually a medical professional. I bet you get it all the time. I mean, yeah, well, as frontline nurses, that's part of what you guys do, is you try to help field people and get them to the appropriate services when the regular system fails them. Which, by the way, again, everybody, you could do more than just a survey at AmericanFrontlineNurses.org. So check it out. But yeah, there's one more clip I want to share, because people send me all these things now as like the rest of the world finally catches up to the red pill waiting in their inbox. They go, John, did you see this? Did you see? I was like, it's like,
it's okay. John, my husband came up to me and he's like, how come people that don't go in the hospital with COVID aren't dying like they do in the hospitals. And I'm like, do you know who you're married to? And I'm like, did you think I was lying? It just dawned on him in 2023.
Yeah. This, I mean, I'm grateful, obviously, that more people are aware now and on board. But wow, it was so painful to get to this point. So here is Francis Collins, about a year or so ago, I think. It's now that the dust is settled. We can have frank discussions, but we couldn't do it in the middle of the chaos because we're important and we have authority and we have to use that.
As a guy living inside the Beltway, feeling the sense of crisis, trying to decide what to do in some situation room in the White House with people who had data that was incomplete, we weren't really thinking about what that would mean to Wilk and his family in Minnesota, 1,000 miles away from where the virus was hitting so hard. We weren't really considering the consequences in communities that were not New York City or some other big city. The public health people, we talked about this earlier, and this is a really important point. If you're a public health person and you're trying to make a decision, you have this very narrow view of what the right decision is, and that is something that will save a life. Doesn't matter what else happens. So you attach infinite value to stopping the disease and saving a life. You attach a zero value to whether this actually totally disrupts people's lives, ruins the economy, and has many kids kept out of school in a way that they never quite require.
Collateral damage.
So collateral damage. This is a public health mindset, and I think a lot of us involved in trying to make those recommendations had that mindset, and that was really unfortunate. It's another mistake.
A mistake?
That caused thousands of people to die and become permanently disabled.
No, these people, it was not a mistake. They intentionally suppressed early treatment options for political purpose in many instances. If Donald Trump said that this drug worked, well, they're going to say it doesn't work. And it's funny that we're now seeing this play out in other areas, like the news this week. CBS, Face the Nation, did an interview with Marco Rubio, and was criticizing J.D. Vance for giving a speech about how the EU countries are full of censorship and overturning elections because they don't like the results, and like Romania. And CBS said, isn't it true that he did this in a country where freedom of speech had been weaponized to commit genocide? The exact opposite is true. Freedom of speech was suppressed. There was something called the White Rose Resistance, where people tried to speak out about the atrocities committed by the Germans and the Nazis, and they were beheaded with a guillotine. And CBS hasn't issued a retraction. Where's the ADL? That's what they're supposed to be there for, is to keep people honest about the Holocaust. So I don't get what's happening, but it seems to be that no matter what the topic, if Donald Trump says the sky is blue, these people will say that it's red. They will say it's green, but it will definitely not be blue. And they did it with medications. They did it with, JD's speech last week. And they've done it countless times over and over. Like, they can't even discuss the fraud, the massive fraud that's being found by Doge, because that they just can't do it. It's amazing. We're in a real weird situation. And I'm so grateful that I have friends like you that I can vent to, because I don't know. Hopefully it's going to get better. But the sad part is that the people that feel this way were the ones most likely to get the vaccine. And I certainly hope that we are fear-mongering about the issues that are occurring with it. I would love that to be the case. I would happily be wrong. But we've seen enough. We've seen enough damage. We've seen enough cover-ups with the NIH that does not appear to be the case. And I don't know where that ends?
I think it took 5 years to get to this point where people woke up and realized the fraud, and I think that's why documentaries such as Epidemic of Fraud that you made is so important. But I think we've got another 5 years to be able to unravel the new fraud from the actual financials that are going on in this country. Because, John, you chased the money trail numerous times to these NGOs that were being paid to actually, what military defense contractors, why are they in the misinformation game of COVID?
Right.
Like, why are you paying influencers to, combat misinformation? And you chase that entire money field. And I'm like, that was just the tip of the iceberg several years ago.
Yeah.
Imagine what we're going to find now.
Now that we have access and, he's going to need our help. Bobby Kennedy has got the keys to the kingdom, and he can start to allow access to, if it's not me or you, please, anybody, Texas Lindsay, any of the journalists that have been trying to cover this. I mean, we know where to look for the bodies. So let us just find them and let the truth come out, because this is the most awful gaslighting I think that has ever occurred. And it's global. It's a planet-wide deception, and the fallout's just begun.
Mm-hmm. I mean, we're already seeing, quote unquote, the turbo cancers. We're already seeing the autoimmune disorders are skyrocketing. I mean, you can't deny the data. If you look, even the CDC's website, we call it the MOMO, the Morbidity and Mortality Weekly that comes out. The numbers have skyrocketed in certain disease processes since the vaccine rollout. And we're not talking increases in COPD, asthma. We're literally talking all of a sudden, colon cancer is a huge one. That's definitely one. And all the autoimmune disorders, all the POTS, it's how the data's there, but everyone is just like, man, I really wish we could figure out what could have been causing this. And I'm just like, what is going on?
Anything but the thing.
Anything but the thing.
Well, Nicole, I appreciate you as always for coming on and telling us what you got going on. Anything else you'd like to add?
No, just if you are someone or you had a loved one that was negatively affected by Remdesivir, even if they survived, go to AmericanFrontlineNurses.org and fill out that form. This research is going to be absolutely imperative to finding out exactly what happened, because we cannot trust the actual quote unquote official researchers to do it. And we are especially looking for participants who got it while pregnant, because they are trying to say that it did not cause birth defects, and we are saying that it does. So that's it. Thanks,
great.
John.
And if I ran a $1 trillion agency of the government tasked with health, and we've been giving out cash hand over fist to morons, teaching people about urinals in Afghanistan. I don't know. Maybe we could also fund this. Maybe I'm crazy. But
Well,
seems like
that's
something
one
worth
reason
funding.
why it took so long. I kept trying to find grants, but if I'm not a transgender, Middle Eastern, make a cartoon for LGBTQ, there was no funding for anything like this at all. I mean, because we have tried for years to find the funding, and then now we're just like, we're going to have to grassroots this now.
Well, hopefully you'll get donations and a lot of information. Thank you so much, Nicole.